please welcome Dr. Jonathan Burroughs.
So I am here not as a futurist. I'm here to explain the 21st century. Parenthetically, we are in the 21st century. So let's kick this off with just to tee this up. What is this healthcare transformation? Who's driving healthcare transformation? Anybody? Who's driving it? And please don't tell me President Obama or Congress. Discounted, politicized fee for service. So let's play a little game that we play in America called follow the money. Whenever anything looks irrational in America, all you have to do is play follow the money, and then what appears to be irrational is suddenly very rational, simple, and easy to understand. So, who sets the rates for why some physicians earn 4 times more than other physicians? Who sets the rates? CMS is correct, through MedPAC, Medicare Payment Advisory Commission. MedPAC is overseen by whom? Hint, who fired Jon Burroughs? Congress, that's right. Who elects Congress? And don't tell me, please, the electorate. Who truly elects Congress? Lobbyists, soft dollars from large corporate interests. That's exactly right. You all know you get a choice between Democrat and Republican, but they've already been handpicked for you. You all realize that, don't you? They have been handpicked. You get to choose between vanilla, chocolate, and strawberry, but the ice cream company has already been vetted and chosen for you when you finally go to choose your flavor. So if you ask a doctor, so what do you get paid to treat somebody with chronic depression? They'll tell you diddly squat. On the other hand, I can put in lots of stents, I can put in implants, I can do lots of artificial hips and knees, I can do all that stuff, and I will be richly rewarded for doing that, whether somebody needs it or not. Here's another one. My wife tells me, John, why do you have a slide up there nobody can read? I say, because I explain it to them. This is called the Preston Curve. Preston Curve is an epidemiologist, and he demonstrated that you get your greatest return from healthcare with the early dollars you spend, and then you get decreasing return, incrementally less return, the more healthcare you provide. Now, all those little dots there is all the 36 other industrialized nations in the world. This little dot over here is USA. This is how much we spend per capita down at the bottom, and this is life expectancy on this side. So not only do we spend more money than everyone else, but we don't even live as long as everyone else. Can anyone tell me why we don't live as long as 36 other countries in the world? Stress. Diet. It's the way we spend our money. For instance, the 2 most common reasons for premature death in the United States are, do anyone know what the 2 are? Heart disease is caused by, primarily, smoking and, what's number 2? Obesity. Does anyone know what the 2 primary causes of smoking and obesity are? Depression. Depression. 10 to 15% of Americans have clinically significant depression. Try finding reimbursement for treating that. You know, people eat because they're bored, they're unhappy, they're anxious, they're nervous. That's why they overeat, and they smoke because they're depressed. They drink coffee and caffeine because they're depressed. They're self-medicating themselves. People have been self-medicating themselves for years in our country, and there's no reimbursement to take care of that.